And for more on the presidential transition, we now bring in Dr. Celine Gounder, a member of President-elect Biden's COVID-19 task force and an infectious disease specialist at Bellevue Hospital Center. Dr. Gounder, thank you for joining us, especially during this extremely busy time. Of course, President Trump has not conceded defeat, and the GSA has not officially started the transition process. What contact have you had with the current administration's COVID task force, and how much has the lack of coordination set back your team?
Well, unfortunately, we simply cannot have formal contact with the current administration, with our counterparts on the White House Coronavirus Task Force until the GSA moves forward with ascertainment. Every day that goes by without ascertainment, every day that goes by where we're not having those conversations is a day lost in terms of moving forward on plans for testing, for vaccinations, and so on. And all of that will translate into lives lost.
Now, if you could be talking with the White House Coronavirus Task Force, what types of conversations would be happening right now?
Well, we'd really like to know a few things. One is, in terms of the supply chain, where are we at in terms of personal protective equipment, ventilators? You might remember earlier this year, we discovered that many of the ventilators in the stockpile didn't work. So we really need to know what supplies we have at our disposal, where, and how easily they could be redeployed based on where they're needed. We also would really like to know where things are at in terms of negotiating with pharmaceutical companies for vaccines, for the monoclonal antibody treatments, so that we can figure out, we can start to strategize about distribution. And some of that's also including conversations with other members of the private sector. So, for example, retail pharmacy chains or state and local officials. Again, this kind of distribution is a massive logistical challenge, and Americans probably don't remember the polio days, but that's the last time we've really had to do that scale of mass vaccination.
And Joe Biden will, of course, take office on January 20th. At the same time, it's believed that a vaccine may already be authorized. How will your task force handle that?
Well, in terms of how to scale up the vaccine, we're really going to be emphasizing distribution to frontline healthcare workers, essential workers, people who are at highest risk. So that will include people, for example, living in nursing homes, assisted living facilities. And then we also realize that communities of color have faced a disproportionate burden of the coronavirus pandemic. They will be among those targeted. But, part of the logistics here is also figuring out which of these vaccines will work for which of these populations best because of the characteristics of the patients, the vaccine, and the distribution characteristics.
NIH Director Francis Collins said that 90% of Americans need to take the vaccine for this pandemic to end quickly. Realistically, how many Americans do you think will actually take it, and how can you change hearts and minds on this?
Well, unfortunately, there are a lot of vaccine skeptics. There were a lot of people who were hesitant to get vaccinated even before coronavirus for any number of reasons. Some of them don't want to be told by the government what to do. Some of them are suspicious of the pharmaceutical industry. Some people think, well, natural infection is better, which it is not. And then now you have all of this politicization injected into the approval of this current vaccine or the current vaccines for coronavirus. And so I can understand why people are skeptical. I would say that we are not putting pressure on the FDA, the Biden-Harris team. We are not putting pressure on the FDA to expedite the approval of the coronavirus vaccines. We really want them to conduct their normal scientific vetting to provide the emergency use authorization so that people can really have confidence in this vaccine. But we're also going to have to do a lot of work around messaging about reaching out to all of those different communities who do feel skeptical and are hesitant and understand where they're coming from and address their particular concerns.
The president-elect said today he would not lock down this country, but if the worst fears about holiday travel prove true, would you recommend a national lockdown?
Well, we've learned a lot since the spring. I think of the spring as the on and off light switch, and now we have a dimmer switch. We can be a lot more targeted in our restrictions. We don't have to lock everything down. We know that certain types of settings, for example, indoor dining, private parties are far higher risk for transmission than are, say, schools. So we can be targeted geographically by zip code based on community transmission, and we can be targeted by the type of setting that's most likely to transmit.
Now, President-elect Biden stressed the need for a national coordinated plan to combat this disease. How difficult will a national plan be after the Trump administration gave power to the states to craft their own strategies? And do you expect governors like Governor Kristi Noem of South Dakota to get on board?
Well, it's important to remember that we are a federalist society, a federalist government. And so you're always going to have differences among the different states in terms of what they're doing. Some of that's frankly appropriate because they do have different demographics, different settings, urban versus rural. It's not going to be necessarily the same strategy that makes sense. But you do need a nationally coordinated plan. And I think you're going to see an empowerment of the CDC in terms of being able to truly disseminate guidelines, recommendations, and importantly, technical assistance to the states and local health departments to really help them in partnership.
Dr. Gounder, thank you so much for coming on the show. We appreciate your time.
My pleasure.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.